Greetings everyone, Dr. Cole Rasich coming at you with another edition of Pandemic Knowledge Bombs, taking a deep dive into the research here at Advanced Physical and Aquatic Therapy in the beautiful Delaware County, Pennsylvania. This week's edition, I wanted to share with you some pretty topical research that actually came out of the Lancet Journal, January of this year, 2020, where they looked at predicting the onset of flu-like symptoms in individuals by using technology like the wearable devices, Fitbit, the Apple Watch, and the Garmin Watch, in particular using our resting heart rate data at determining when someone was in the early stages of fighting an infection. And a lot of times they were able to see an increase in our resting heart rate prior to the subject's self-reporting that they were feeling ill. So how can we use this in our everyday lives? The first place I'd like to start, number one, is if you guys have a wearable watch that tracks your heart rate, you definitely have access to your resting heart rate data. If you don't know what that is, after watching this video, hop onto that app and find out what your resting heart rate is, and then track that over the course of the next week. It's gonna fluctuate a little bit. There's a lot of factors I'll talk about that can change that. And that's normal. Men and women, it can differ a little bit throughout the month. And again, there's a lot of different factors individually that come into play, but I just want you guys to get a baseline 1 week of what your resting heart rate is. And that way you're able to track it more effectively each day. You don't have to be OCD like me and look at it every couple of hours, but every morning when you wake up, I would just check in with what your resting heart rate is, and that way you have a sense of what your normal baseline resting heart rate is. If you start to see an increase in that, again, don't be alarmed. There's lots of factors like cardiovascular activity is a great way to decrease your resting heart rate. Certain dietary choices can increase it. Sleep or lack thereof is a surefire way to increase it, as well as stress. Those are all really common things that I'll flesh out a little bit more. What I would be concerned with, based on that research that we're talking about, is if you see a really sharp uptick in your resting heart rate in a short amount of time, I would become a little bit more disciplined in some of the big three that we talk about in clinic a lot with our patients. Now, we share this information with our clients just looking to decrease their pain, looking to increase athletic performance. But in times of illness and infection, these three strategies can be huge at mitigating some of the impact from that infection. And a lot of times you see that infection or that cold or flu can be shortened in duration when you take these things seriously. So hopefully when the time comes to where you're seeing that resting heart rate climb up really quickly in a short amount of time, you can implement these three strategies and try to stave off some severe symptoms there. Number one I'm gonna talk about is sleep. So normally we want everyone to aim for 7 to 9 hours of sleep a night, but when you're fighting off an illness, it becomes even more imperative that you are nailing that 8 hours of quality sleep a night. Your body's gonna need that time to recover and to fight off that infection. Number two is fuel or kind of nutrition and dietary choices. Our typical Western diet is very high in processed foods, dairies, and meats, which are pro-inflammatory in nature. When we are fighting off infections, when we're fighting pain, when we're looking to improve our cardiovascular health, it is very important that we increase our dietary intake of vegetables and fiber. I'm a big fan of the Canadian food plate. If you're not familiar with it, I'll tag the picture to this video. But essentially, you want your plate to have about 50% of it should be comprised of vegetables and fruits, high in fiber and leafy green. But again, that becomes even more imperative when we're fighting off an infection. The third strategy I want to talk about is stress management. We've talked about that in previous videos, the notion of resiliency and endurance in times of tribulation. So if you are starting to see that climb in resting heart rate, 10 minutes a day is a great starting spot of just no cell phones, no TV, no news, just quiet place, dark room, no distractions. Work on that box breathing, whatever you like. and really work on managing that stress and decreasing the overall toll it can take on your body. So again, after this video, find out what your resting heart rate is, and then use those 3 strategies all the time. But in particular, when you are starting to see that resting heart rate climb, start with those 3 strategies. If you need any help, I will gladly point you in the right direction. I have a lot of resources I use in the clinic with regards to sleep hygiene and some nutritional changes. So feel free to reach out to me. I love to share that with you guys. But until then, stay well, stay healthy, be active, and enjoy time with your family. All right, guys, take care.